Toss endless online searching to the curb. Let us edit out the noise and bring you medicine without misinformation. Welcome to the Med Edit Podcast. We are back with another episode of the Med Edit Podcast. I am Dr. Gray, joined again by Dr. Carrie Sorrell.
Hello there, and welcome everyone listening.
Today we are tackling another taboo subject, something that oftentimes the listeners have been asking questions about.
That's right. We're going to talk about therapy and specifically counseling. Now, I know you're thinking, I already know about counseling. I don't need to know about that. Or maybe like that stuff doesn't work. But we're here to break down some fact from fiction for you and to connect our listeners with evidence-based information by dedicated professionals.
Today in studio, we have Dr. Zach Trevino, a psychologist with a wealth of knowledge we are excited to learn from.
Dr. Trevino is going to be helping us address those myths about counseling and help us navigate treatment options for many mental health concerns.
And you know we're long overdue for another Hollywood hype segment. So this one we picked out was extra special, talking about therapy and mental health. You do not want to miss it. We're tackling a very fun subject, talking about Justin Bieber. You heard that right. What other podcast gives you factual medical education and also talks about the Biebs?
So let's get started. For today's episode, we're going to be breaking down the barriers and addressing stigma of mental health and specifically counseling. We have, as just mentioned, Dr. Zach Trevino here. Dr. Trevino is a licensed psychologist practicing in Lubbock, Texas. He has a PhD from Texas Tech University, as well as a master's degree in marriage and family therapy from Tech. Dr. Trevino's area of specialty includes couples therapy, communication issues, and family conflict. He's engaged in ongoing research as an adjunct instructor at Texas Tech University, and he uses his social media to fight back against misinformation and encourage mental health support, a lot like Dr. Gray and I do. According to Dr. Trevino, relationships are the cornerstone of life. Being able to have healthy, trusting relationships with ourselves, our partners, our families allows us to be who we were meant to be. Welcome to the Med Edit Podcast, Dr. Trevino.
Yeah, thank you so much for inviting me to contribute to this wonderful space and the wonderful work that you are both doing to fight back against medical misinformation. I've certainly checked out your podcast and I've listened to several episodes along the way, so it's been fun to do that. And I'm excited to join in on the work that you're doing. And I really see this as a privilege and an honor to be in this space with you. And I'm excited to chat it up and impart some wisdom upon the listeners.
Absolutely. We're super excited to have you here. So Let's start with the basics. Some of our listeners may be wondering right away. Often patients confused what a psychologist and a psychiatrist do. Tell us about your role in addressing patients' mental health needs.
Yes, great question. So as mentioned, I'm Dr. Zachary Trevino, and I'm actually a licensed marriage and family therapist and have extensive clinical training across many clinical settings, treating diverse clinical problems and presenting concerns. And when I think about the topic of what the heck is a psychologist versus a psychiatrist, I think generally speaking, society often confuses these things and has a lack of just like mental health literacy and understanding certain providers. When I think about the mental health field, there are numerous mental health license and providers. So we have psychologists and psychiatrists and marriage and family therapists and licensed clinical social workers. And each of these providers, I really value their contribution to the work that our country is facing regarding this mental health crisis. And so while we're all holding different licenses, I really believe we're all working towards the same common goal. I like to think about this as a metaphor of climbing a mountain. Each of us as providers can start at different points of climbing the mountain and really work to get to the same place using our therapeutic approaches, our evidence-based practices, and things of that nature. But when it comes to psychologists versus psychiatrists, psychologists, mental health providers are often providing direct psychotherapy services, which is your traditional one-on-one or working with a family or a couple in a counseling space. And really being able to address the mental health needs of not just individuals, but as an MFT or a marriage and family therapist. I also treat couples and families who are presenting with a wide range of clinical issues. And so my work really revolves around, it's not a one-size-fits-all approach. And as an MFT, I'm unique in that I'm set apart from psychologists and psychiatrists and that I have training that's systemic in nature, and I have been trained to work with multiple people in the counseling space. Whereas licensed professional counselors, psychologists are often just working with a very individualized type of approach. And so I think we all work together hand in hand to provide comprehensive mental health care. But generally speaking, psychiatrists attend to the psychological, psychotropic medications and treating symptoms. And psychologists, mental health professionals, we're providing the direct psychotherapy services. And again, I'll ideally working together to provide comprehensive care to individuals and families and couples.
Absolutely.
And you mentioned that you're talking specifically about couples therapy, family therapy being your passions, your specialties. Tell us a little bit more about your specialties and what drives you and why you choose them.
Yeah. So I believe that we, at our core, are relational beings, that we're inherently relational, and that the foundation of our lives is really built upon the relationships that we form with others. And that this relationship with others plays a crucial role in our mental, emotional, and physical health. If you think about like the last problem you have faced in your life, perhaps there's a person connected to that problem, right? And so I really believe that because we're foundationally relational beings, that in order to provide effective, comprehensive care, we have to consider the relational context that we exist in, the social context that we exist in being able to provide a high standard of contextually, relationally informed care. And so I am super passionate about treating couples and families because I know that every family and every relationship comes with a set of problems, And so I really value the work of sitting with and being entrusted with couples and families and helping them navigate the day in and day out challenges of life, whether that be anxiety, depression, grief and loss, being isolated, things of that nature. And so I really strive to be able to attend to multiple people in the therapy process and to be able to treat them holistically and systemically.
So often my patients will say they've already tried therapy. When they come in to see me in the clinic, they say, okay, I'm anxious, I'm depressed, I'm having anxiety attacks, panic attacks. They were describing all of those physical, emotional feelings. And, I'm here as the person who can prescribe medication, right? I can't do the actual counseling aspect. And I'm a huge proponent of counseling, huge proponent. I think it's fantastic. Yep. And we talk to our patients specifically about, let's say, generalized anxiety disorder. Yep. That one specifically has evidence that the combination of counseling, usually through kind of cognitive behavioral therapy, which we'll talk about in a minute, what that specifically means, plus medication like an SSRI, is more effective than either one by themselves. So if I can only do half of that, then I really rely on someone like you in the mental health world to be able to actually provide that counseling. I can provide a minimal amount of counseling in a 15-minute visit. Carrie's got her patients in her clinic who are there for a GI complaint, but all of a sudden maybe discussing some of their anxiety and depression symptoms that are probably contributing to that GI complaint. But we can't do that. And so we often will say, let's add in some kind of counseling component. But what happens when the patient tells us they've already tried therapy, or I have friends to talk to, I don't need to talk to a stranger? What is something that you would say to that person?
Yeah, great question. So one thing I want to highlight here is I love the work that you do. In fact, there's a stigma about mental health seeking and then the seeking service process because of just culturally and socially, we have these narratives and messages about what it means to be a person to seek mental health. As medical providers who recognize the significance of mental and emotional health, you are actually on the front lines of being able to be that bridge between patients getting into the counseling space. And so I think that's so important for medical providers to be able to be that bridge. Perhaps you're the first voice of reason and the first person to plant the seed of maybe we should consider these things. So I just truly appreciate that, the work that you do. But beyond that, many people have had negative counseling experiences. The data suggests this, the research is suggesting this. And it's really hard to want to do that again if you've encountered a negative or have had a negative experience with a provider. I like to believe that finding the right therapist and who you feel comfortable with is so important. What we do know in terms of the literature is that your relationship with your therapist actually has more significance in terms of positive therapeutic outcomes than perhaps the techniques or approach that your therapist is using.
That's
So what the
interesting.
data suggests is your relationship with your therapist is the most what's the word here? Predictive factor of successful therapeutic outcomes. So this process is so important. In order for us to see improvement, you have to feel safe and comfortable with your provider. And so therapy is a highly individualized approach. And what works for one person may not work for another. So my conversation with people and folks in my life and even clients is to like shop data around, like ask questions and schedule consultations with therapists. Like that's something that many therapists do, is trying to figure out, are we a good fit? And is this a good suit? And is this imminent? And how can I treat you? And how can I help you? And you need to be able to have a great relationship with your therapist if you want to have successful therapy outcomes. And so to those who have said they've tried therapy and have had negative experiences, try again, which it sounds, I hate to say that, but try again. Find someone who you can resonate with. Find someone who looks like you. Find someone who is specifically treating the problems you're engaging or dealing with. Those things are so important and have a significant influence on your therapeutic outcomes. Regarding the idea of talking to friends instead of your therapist, I'm glad you have a support system, and friends and family can provide support systems, or support to us, rather. There's a key difference between friendships and them providing you the space to vent and seeking out professional counseling services. Therapists have training and a skill set to be able to provide non-judgmental listening and to structure the dialogue and to attend to certain things and to help you develop insight and awareness, self-esteem and empowerment, and so on and so forth.
So what I can say is it especially resonates with me what you're talking about, because with my patients, I tell them all of the time, I say, it doesn't matter if you've tried someone before. Going to therapy, finding the right therapist is like dating. I heard you say that. I completely say that to my patients as well. I tell them also that the first date isn't always indicative if you're going to marry the person or not, right? So sometimes you need to go on more than one date to know if this is exactly the right fit for you. So I tell them there is no way a therapist is going to know your entire life story and be able to give you tangible results in maybe 45, 50, 60 minutes that you sit with them on that first date. You have got to keep going with them and bring it back around so that they can get to know you a little bit more and you develop that relationship.
So tell us the differences between the different kinds of therapy that you use in your treatment approaches.
Sure. So as a marriage and family therapist, really the hallmark and the cornerstone of my treatment is that it's systemic in nature, meaning that I am trained to be able to treat multiple people in the room. And so when I think about the approach that I utilize and the treatment that I provide, it's not a one-size-fits-all approach. So I utilize various kind of methods and approaches in my practice. I recognize that what I do for one client may be different than another client. And so the approaches that I use are evidence-based, grounded in research, empirically validated, and really the literature has really demonstrated effectiveness of the things that I do and the work that I provide or the services that I provide. And so by using things like cognitive behavioral therapy, that may not be the approach that I utilize in treating a family who has a non-compliant teenager. Now, I may be able to utilize components of cognitive behavioral therapy, but I have to learn how to adapt that and modify that to be able to treat the non-compliant teenager and getting both parents and child to recognize that they all have a role and contribution to the problem that they're encountering. And so I think by not necessarily being eclectic, but by being informed and educated to be able to utilize multiple approaches, really allows my work to be both dynamic and fluid, and essentially meet clients where they're at, and helping them achieve lasting and meaningful change.
Yeah, I love that.
Yeah, so it sounds like CBT is something that you use pretty frequently and just kind of adjust it based on the patient or group of patients that are in front of you, it sounds like.
Yes, absolutely. CBT, we know, is the beast in the mental health field. It is the most empirically validated. And so certainly pulling from that and and really seeing the benefits of clients from being what's the word here? Yeah, seeing the benefits of clients or reaping the benefits of cognitive behavioral therapy. Rather, I see it happen all the time. So
awesome. Well, kind of just to put some of our listeners at ease who are maybe thinking about counseling, what does a first visit normally look like with you? You know, from the moment they may call to make the appointment to when they're sitting in your office, what it is like, or do you have any tips to make that first experience more positive for them?
Yeah, great question. Reaching out to a therapist and making that initial contact is the first big step. In fact, what we do know is some research shows that the minute that clients make that contact, motivation, internal motivation, and change begins to show up for them. And so that process can be really anxiety provoking for many. Thankfully, there's not necessarily just one way to do that. Email, contacting a receptionist, things of that nature make it more accessible, and being able to just email a potential therapist versus having to get on the phone. And so that initial contact to the process of getting the client on the couch, I recognize can be a really challenging place to be for clients. And so as a therapist, I really work to try to make that process as smooth as possible. This really looks like clients making initial contact with me. I don't have a receptionist. I run my practice. They get in contact with me. I gather relevant contact details and information, and then really get just some brief information around their presenting concerns. This really helps me to determine the urgency and suitability of my services. And then we discuss things like a date and time that works best for them, and working to accommodate their busy schedules. And then I kick clients over just some general basic paperwork that gathers medical history, mental health history, and they complete the informed consents. That first session is where the nerves really kick it into high gear. This is where the feet are on the ground and clients are having to push past that general anxiety or that fear. And this is where the work begins. And so as a licensed therapist who does many first sessions, intake sessions week to week, I recognize the anxiety and fear that is often present during that first encounter. So as a therapist, I do my very best to meet clients in that space and really welcome that. We welcome that, and I talk about that very directly of what's it like to be in this place? Like, take a look around, you're here, you made it here. What is going on for you? Let's talk about that. And oftentimes we attend to the misconceptions about therapy. We attend to the fears about, well, I'm afraid if I begin to talk about this, it's going to get worse. And so many other questions come up here. So in that first session, many clients have questions like, how often are we going to meet? How long is a session? How long is it going to take for me to feel better? Right? So we go through these questions and really help to attend to that anxiety. Many clients think that going to therapy, we're going to get rid of those emotions, but it's absolutely opposite. We're going to actually befriend these emotional experiences, get curious about them, and get to know them versus suppress them and get rid of them. And so just this first session is going to look like a conversation. Similar to what we're having here is I'm going to connect, I'm going to ask questions, and I'm really going to get to know you outside of your presenting clinical concern. Because again, that relationship is so important. So I want to know how old you are. How long have you been married? Talk to me about your proposal story. When did you decide to have kids? Like, I'm going to get to know my clients on a very personal and individualized level before I even jump into the presenting clinical concern, because that relationship is so important. So it's literally that. It's dating. It's building rapport. It's connecting and establishing trust. And I do my very best to meet all of my clients where they're at with that fear. That doesn't mean after that first session that fear goes away. However, that fear often becomes less and less, and clients usually begin to look forward to coming to therapy. So when I think about tips for making it easier, one thing that just sounds very therapist-y of me is to just let yourself be scared. That feeling and that sense of fear is really normal and appropriate. And you're not wrong, you're not bad because you feel those things. In fact, you're human for feeling those things. Anytime we're doing something new, that is scary. and prioritizing your well-being and your emotional health, going to get the treatment you need is really scary. And that's okay. That's why you're here. And so let yourself be scared. Reach out for help, scared. That's okay. Remember that therapists are there to help you and to support you. And I want to help and help you grow and evolve and change. And I do my very best to do so. Very silly and simple here. Some clients think that they have to dress professional to therapy. Dress comfortable. Bring water. Bring a snack. I have snacks in my waiting room. I have waters and drinks and sodas and so on and so forth. But dress comfy. Like, we're going to have a conversation. You're going to get comfortable on my couch. We're going to get to know each other pretty dang well. And so just dress comfy. And trust yourself. Trust yourself that you are doing something to prioritize yourself. And that is brave. That is courageous. And I have so much respect for the people that choose to do so. So much respect. And as a therapist, I see the work I do as an honor, not a right. It's a privilege. People don't have to come here. People don't have to entrust me. But people who choose to do so, I respect, and I don't treat that lightly. So trust yourself, do it scared, and I hope that you're met with compassion and kindness from the provider that you're working with.
I love those tips. Those are so sweet. I feel like those could be written on little note cards or on someone's. I was always with a friend last night at dinner, and they had wrist bracelets that had cute little motivational sayings on the inside, and you flipped them over. I'm like, let yourself be scared. These are great ones, especially for going into a scary situation like
Absolutely.
therapy.
Wouldn't it be nice if an actual first date you could do that?
Oh,
You're
right.
like, be comfy, wear whatever you want. Like, it's okay, be yourself, right?
That's a good point. That's a very good point.
So, Zach, what would you say to someone who's worried about other people finding out they're in therapy? What if they're struggling with the idea of it being shameful, or they're worried that they're just failing if they decided, okay, we're going to couples therapy, or we're going to get therapy for my anxiety or to my depression?
Yeah, going to therapy is confidential. So no one has to know if you're going to therapy. That is your right and your choice to share with others and let them in about this experience. This brings into conversation the topic of stigma. And so oftentimes clients want to attend therapy but don't want their family members to know. That's really your right. You don't have to share that information. Now, I do work with my clients to empower them to share the work they're doing with those in their life who are significant, but it's not something you have to do. That is your choice, and you get to decide that. So no one will know. If you're going to therapy, I've had people in couple relationships where one partner was coming to therapy and their spouse didn't know. That's a whole different conversation, but you get to decide if and when and who you share that information with. I think there has been a significant cultural shift in how we view mental health. I think many people are openly discussing this experience with therapy, which helps reduce the stigma. But again, I still think we're still in this movement and this shift and change where some people just have some pretty negative core messages and beliefs about what it means to seek out therapy, and really working to reframe that around seeking therapy does not equate to failure or brokenness. It really means bravery and strength and saying yes to your future self and evolving and changing and growing. So no one can know if you're going to therapy. That's your right. And I empower clients to decide if and when they share. So
great. So it's really important. I think that does make a big difference in that someone needs to know that that's their personal relationship with their therapist, and it is confidential. Just like for us as doctors, it's completely confidential whether you come and see us at all or what you're seeing us for, and your medical records are as well. So we're going to switch here. We're going to go ahead and hop into the Hollywood hype, because I know that that's always a fun one. And we're going to get your opinion, Zach, on this as well.
Awesome. So on this subject, as Jess mentioned, we're going to transition, but still on the mental health topic, we're going to dive into this segment on Hollywood hype where we are going to talk about our celebrity, Justin Bieber. As always, it's our favorite segment to do, and we love to hear what you have to say.
So mental health is a taboo subject for everyday people as well as celebrities. We'll just say it is. Sometimes you hear about them doing it, sometimes you don't. So when a celebrity is able to be open and honest about their journey, especially in today's day and age with social media, their struggles and their voice describing what's going on with them can be really encouraging. Justin Bieber has been in the public eye since he was very young. His life has been on full display for the good, the bad, and the ugly. His relationships, drug abuse, drama, they've all been front and center on tabloids, on social media, everywhere. One thing that has been interesting about Bieber is that he's been willing to be vulnerable recently and open up when talking about his mental health struggles. And he's been talking about the steps he's taken to tackle these struggles. He's been open about seeking professional help and following with a therapist for counseling, which has been really nice because he's of the age of a lot of people on social media and they watch him grow up, for good or bad, whatever you think about the guy. It's just one of those things when you see somebody say, hey, this is how I'm not perfect and I'm trying to overcome it, and they're making positive strides. It's really a good, positive thing to see. But he's been quoted recently saying, I enjoy meeting such incredible people, but I end up feeling so drained and filled with so much of other people's spiritual energy that I end up drained and unhappy myself. I want to make people smile and happy, but not at my expense. And I always leave feeling mentally and emotionally exhausted to the point of depression. The pressure of meeting people's expectations of what I'm supposed to be is so much for me to handle and a lot on my shoulders. Dr. Trevino, when you hear this quote from a celebrity or from, a lot of it could resonate, which is a regular person as well saying some of these things, what does it make you think about as a therapist? Is this a common feeling that maybe you've seen other people express?
Yeah, first off, I am a millennial and have witnessed Justin Bieber grow up and evolve into the person that he is today.
Us too, and why we picked it.
And I also love how certain celebrities are using their platform to be able to talk about things like mental health. Mm-hmm. This really can contribute to that larger cultural shift that I've been talking about in terms of the way we think about mental health and talk about mental health. So as a therapist, when I see this quote and I hear this quote, it resonates deeply with a common experience that many people have and really highlights the profound impact that people experience as it relates to people pleasing and meeting others' expectations and the implications on our mental health and our well-being. The feeling of being drained and overwhelmed is something that I hear day in and day out in my clinical practice. So it's not uncommon that this experience that Justin is sharing, it's so parallel to the things that I treat and see day in and day out. But it also makes me, just think about the importance of addressing the pressures and expectations that are placed on us as humans and finding healthy ways to manage these symptoms and learn how to sustain our mental health and our well-being.
Wonderful. Yeah, I love that. And we knew you weren't treating Justin Bieber as a client, even though that would be awesome. But what treatment approach would you maybe consider taking with somebody struggling with depression, anxiety, or the relationship issues as he has described?
Yeah, when I think about that, while I'm not treating Justin Bieber, that could be cool. If someone were to come into my office with similar struggles of depression, expectations, anxiety, relationship issues, I'm going to utilize maybe CBT, but I'm also going to sprinkle in other things like attending to someone's sense of self-worth and sense of self-esteem. I'm going to attend to things like coping skills, social support, financial resources, educational level, and really helping. That's the nature of the work I do, is contextualizing my clients and helping them recognize the role of these factors in who they are today and their presenting concern. This also means I'm gathering family of origin history and what was it like to be a child and how did your parents respond to you as a child when you were an emotional kid. Oftentimes when I think about the concept of people pleasing and expectations, I often say people pleasers were parent pleasers. And so just helping my clients develop insight and awareness as to where's the origin of it, where does this come from? What is the etiology of this behavior? It didn't just happen. It was birthed by an experience of being negated or invalidated or being told to go to your room as a kid. And so helping clients just really understand the origins of certain behaviors and how perhaps those behaviors were a response to surviving and adapting, and thinking about how might those behaviors no longer be serving us in the present? How might those behaviors be impeding on our ability to function healthily today? And so whether it's Justin Bieber or just your average Joe, my goal as a therapist is to attend to some of those root causes of their distress and be able to provide practical tools for improving today. I often say we cannot change what happened to us in the past, but we can decide today how we let the things from the past impact who we are today and who we are becoming. So in my work with clients, it's not only just this process of becoming someone else, it's also this unbecoming of what we thought we were supposed to be based off of the expectations that have been imposed upon us by our parents, our society, our friendships. And so that's kind of my go-to here. This is how I would attend to those things in a very brief way. It is so much more than that. Therapy and healing and evolving is not a linear process. Rather, it's dynamic and circular and ever-changing, and it is certainly a journey rather than an outcome. And that sounds very cliche, but that it is. It is not an outcome. It is not a sprint. It is a marathon, and it is a journey. And I just feel really privileged to support people in that marathon and in that journey in becoming their highest, wisest version of themselves.
I love that. I love that. That really does, that sheds so much light on a multitude of things, right? Hopefully from this discussion with us and with you, a patient or a client, for you, they may be able to feel comfortable enough to take that first step and pick up the phone or send an email, if they don't want to actually talk on the phone. A lot of people don't want to talk on the phone when they have that much anxiety, but this is such an important aspect. And I think you've given some great pearls of wisdom that even somebody just at home trying to figure out their next steps or just rationalizing the feelings of, do I want to take this next step in my mental health journey, will be able to implement in their lives. Oftentimes people want a pill alone to make things better. They come to me all the time just saying, just give me the pill that'll fix it. And unfortunately, most of the time, the pill alone is not the answer. And so we need to add that therapeutic approach with the whole treatment team. By putting in the hard work in that therapy, it can really make all the difference.
Absolutely. Yeah. I feel helped already.
I know. I feel good by the end of this episode.
And it's funny you say that because it's not even just for medicine. Like we were at a tennis lesson and the coach was like, I cannot give you a pill to make you serve better. Like you just have to practice. Like you have to put in the work. And I think that's true with absolutely everything in life. Like it's putting in the work, it's showing up. And hopefully we've helped some people feel more comfortable about putting in the work into themselves, like you said, to make them the best version they can be.
Something I like to tell my clients is, we often think that we have to have confidence before we learn how to ride the bike. But in fact, the confidence comes as a result of getting on the bike, falling off, and getting back up. And that same process parallels to coming to therapy. We have to put our feet forward, one foot in front of the other. And as a result of facing that fear and doing it scared, there is potentially growth and change and healing and health on the other side of that. And so it's been a pleasure to chat with you both, and really just appreciate the work that you're doing and the work that you do on Instagram. It's always fun to see the things you're sharing. So yeah, thanks for having me. I'm really grateful for this opportunity, and yeah, just thanks so much.
Oh, thank you. And that's a wrap for today. Thank you again, Dr. Trevino, so much for joining us today. As a reminder, don't forget to check out the show notes in order to be able to claim your CME credit.
Thank you all for listening. Please like, subscribe, and share this episode. Let us know what other topics you're interested in through our Instagram, and stay tuned for the next episode. Thanks.